Hi everyone, it's Amy at Lesimpleholic. I finished radiation this past month and wanted to give my take on it, give my tips, and hopefully you guys can benefit from my experience. So MD Anderson has clinical trials and one of them was in regards to radiation. I submitted my application for it and was selected to do 20 sessions instead of the typical 30 sessions. I highly recommend that you sign up for it through your doctor so that you have a chance to do less. Basically, the study is that there was no difference of 30 sessions versus 20 sessions in that it would prolong the life of a patient after receiving radiation. So hopefully you get that because 20 sessions is kind of where I think you start to really burn and it hurts and your skin is goes through scarring and it might start not having the elasticity that the plastic surgeon team needs. So highly recommend that you do that. After you do that, when you actually want to start radiation, there are a few steps you have to do. The first being simulation. In that process, what I did was lay on this huge machine. There were 2 or 3 techs inside the room. They mark you with a Sharpie all over to line you up with the machine and the lasers, and then they'll tape you so that the Sharpie marks stay there throughout your radiation. Another thing they do is create a custom face helmet so that it fits your face perfectly. After that first step, the second one is a dry one. So I thought that was my day 1 of radiation, but actually it was basically everything, but they didn't actually radiate you. So you kind of understood what you're going through. You would have to go into a dressing room and get undressed and then go to the radiation room. There's about 3 to 5 people in the room. They adjust you to the board and the laser lights. So it was nice that they allow this dry run so that it would make the fears go away, make you more aware of what's going to happen to you. However, I didn't know that was the plan, so it would have been nice if I had known ahead of time. What else? So the actual radiation itself is very quick. You lay on there half naked from stomach up. No necklaces, no earrings, and I think I counted about 10 to 20 times where the tech would over the intercom say, hold your breath. So you do that 10 to 20 times each session, about 10 to 20 minutes, and you're done. You do it Monday through Friday, so it's a everyday job. For me, the first week was quite easy because it started midway. So around Wednesday, I think, is when I started. But I underestimated the power of radiation. I thought, oh my goodness, this is so much easier than chemo. So I kind of exerted myself over the weekend and then I got a migraine. My migraines are triggered by dehydration, which is what radiation does to you. I didn't realize that, so word of advice is to take things a little bit slower, just because radiation is easier than chemotherapy. It doesn't mean that it doesn't affect your body as well, so keep that in mind. What else? My throat felt really scratchy, and I think it's because the radiation not only would hit my chest in the cancer side, but also all the way up to the lymph nodes around my neck, shoulders, arms. So it hits this area, which is why my throat was scratchy. I was told to eat a lot of protein for strength and lotion up after the radiation sessions and after showers, so twice a day usually. I would recommend you wear pants so that you're not completely naked on that board. I think it's great to do radiation in the winter because I noticed my whole body would kind of swell up. My rings were a little tight, my shoes were a little tight. So I can't imagine if this had happened in the summertime. I'm sure I would have ballooned up, but glad it was during the winter. I also asked my radiation oncologist for a referral to do physical therapy. Even though after the mastectomy my range of motion was a lot better, radiation would make me take 2 steps back. So I'm glad I started doing physical therapy right away, and it's helped. But some therapists are more about finding the proper exercise for better range of motion. Some are more in tune with the swelling and will massage you. So it just kind of depends on your preference. I wish I had asked for massages earlier on. That's what I'm going to get next week, because the skin where I have been radiated on, it really hurts to even just kind of touch it like this. It's very tight. And my range of motion is not 100%. I can't lift my arms 100%. I can't go back 100%. So I still do need to work on that. Getting physical therapy during radiation is quite helpful, I believe. The second week of radiation was very hard for me, mentally speaking. Even though it's a quick, 20 minutes in and out, the fact that it was every day, Monday through Friday, and I think around this time point, it was about 8-9 months since I was fully diagnosed with cancer. So it's like growing a baby, and then you release that baby to the world. So there's a lot of emotions, and I think it was just really hard for me, and I broke down quite a bit. Also, I didn't really process what was happening to me during chemo and after the mastectomy. You're in this fight or die situation, so you don't really have time to think about those kind of things. It also felt like the light was never there in the tunnel. I was just always going to have to fight to just live. It was exhausting, and it's been a marathon, so to speak. I wouldn't wish it on my worst enemy. And I'm thankful that I'm here, and I have family and friends who check in and gave me the best birthday ever. Recently I had a birthday. I'm very thankful that I got to see another year. 1 year ago this time, I didn't know I had cancer, but mentally I was in a dark place. And so even though cancer has taken a lot from me and my family, physically speaking, I feel like I've gained a lot in perspective and being more understanding of others who are possibly in the same boat as I am. And so, I don't know, there's been a lot of thinking and processing this past month. I still have a long journey ahead. I have about 4 more immunotherapy infusions to receive. I get those every 3 weeks. So it'll end around, I think, July. And my next steps after that would be reconstruction. I met with the plastics team this week and got some unfortunate news, which was that in order to do what I want, which is remove the other breast tissue, the non-cancer side, and move the belly fat upward to both breasts, I would need to get 2 surgeries. In order for it to be safe, I need to put another expander inside the non-cancer side, and then wait for the skin to get stretched, and then do the second surgery where they would complete the fat relocation. It's a little bit scary, but I'm glad that there's at least a plan in place. It's not just in theory or in my head. There is light at the end of the tunnel. It is coming. It's still not where I want to be. This week, a person that I recently discovered, maybe 2-3 months ago, passed away. She was a big advocate for breast cancer, having had it herself at a young age of 23 and then passing away at 33. It really put me in a mental situation where I was sad. But this time around, I am understanding that when someone passes away, even though that could be me, I have to move forward. I have to keep thinking positively because we don't know what tomorrow has, right? And I can't live in fear. So I have to think positively for my family, for my friends. But honor the person that has passed, right? So that way their light is still shining and their whatever that they were advocating for is not forgotten. So that what's been going on. Physically speaking, all of my levels have kind of returned back to normal except my white blood cells. They are a little bit on the low side, and my oncologist said we would just watch out for them and see, you know, maybe after radiation, a month or two afterwards, if they go back up. I am trying to drink my green celery juice again. My husband's been making it for me, and so hopefully it goes back up again. I do need to start exercising, but radiation just exhausted me, so I will bring that back into my routine. Other than that, I think those are my updates. I do want to kind of share what I used or what I took. When I was doing radiation, my doctor recommended this lotion. Honestly, I don't know what difference it was compared to other lotions. It smelled more like olive oil because there's olives in there. It was very moisturizing, but I don't know. I use this religiously. Also use calendula burn cream. I also used Aquaphor, and I just lathered myself up afterwards. I actually used my child's diaper ointment, baby bum. You know what? Let me go get it and show you guys. It looks like this. And this is what I would use to put ointment on my baby girls when they had diaper rashes, because the diaper rash is pretty thick. And it's nice because there's a suction cup and it stands upright. I actually stopped using this on my children because they've gotten older. They don't get diaper rashes as much, so I'm using it. Did you know you could use baby products for cancer patients? And, you know, just scoop it out and put it all over, because this is also thick and you don't sometimes want to feel that for hours afterwards. So that's been helpful. Another thing I would recommend is buying something that will hydrate you immensely, more than just water. I bought these. It's called Liquid IV. I think that's the brand. There's different flavors. You can get it at Costco, Target, Sam's Club, online. You just pour this into a water bottle. Bring that. I think about 16, 17 ounces of water, and you pour one of these packets in. Shake it up, drink it. I drink about like 3 or 4 of these a day because my migraines are intense and they're triggered by dehydration. So water alone was not helping me, even though I was drinking quite a bit. So this kind of helped me a lot. I only got 2 migraines during the whole 20 sessions of radiation, so I consider myself lucky. Now that radiation is over, I think some people will think you don't need to worry so much, but I'm actually lotioning up even more. My radiation oncologist gave me this, a few of these. I don't know what it's called, but in the back it says this. And it's some sort of protective film. I I don't know how to explain it. It's a Band-Aid type of texture on one side, but it's cushiony and it's sticky on the other. So I actually would cut this in half and then lotion up the area that was radiated on, and then just swap this on. It would stick on. That way my clothes would not get aquaphor all over. It would also help with just the side that got radiated on. Anytime it touches cloth, it rubs and it kind of hurts. So this has been really nice to protect that side, but still keep it really lotioned. I think those are all my items that I use for radiation. Thank you so much for being patient and still tuning in to these video updates. I know there's been less and less just because it has been harder. And going forward, I think my next update will be before I do surgery. So probably around July is when I'll have another video update. But until then, thank you for watching. Wish you guys the best. Until next time. Bye guys.